Hi, I'm Erin. This is our dog Watson. He is a 9-year-old Pembroke Welsh Corgi, and he herniated a disc at T11 and had a hemilamonectomy. I wanted to make this video to help out folks that are freshly out of surgery with some of the tips and tricks that we learned with Watson. Watson is currently 7 weeks out, so he's much more able than he was before, but I wanted to share this. So when your dog first gets out of the hospital, they'll be on lots of medication. So I kept all of my medication in a bag. The hospital had him taking pills at all hours of the night. So I made this chart, and my chart, what I would do is I would write the time and the medicine he was going to take, and when I actually gave him the medicine, I would put a cross through it so that I knew I had given him the correct medicine. If the medicine is at strange hours of the night, such as 5 a.m., you can slowly move it forward by changing it to 15 minutes later. So you'll see here I moved it to 9:15 and then 5:30 and then the next day 1:45. So that can be pretty helpful so that you're not getting up 3 times a night. Another thing I noticed with Watson was that he became very restless with the prednisone. Your dog has probably been prescribed prednisone. It's very common, anti-inflammatory. I started giving Watson that during the day so that he wouldn't be as restless during the night. It also made him very thirsty and sometimes even panting, which is completely normal. If you Google prednisone, those are all common symptoms. So the strategy that I used for Watson when he first got out of the hospital, and he was fully paralyzed from basically the end of his ribs down. When we would pick him up, his back end was very floppy. It was like a sack of jello. So we got one of these side entry crates. I found this, Watson, you can tell that he's restless because he's no longer doing a lot of crate time since he's on to the next stage of his journey. But this side entry crate was really great to scoop him out. So when I would take him out 5 to 6 times a day, Watson, wait. Using this side entrance, I could pick him up, supporting both his back end and his front end. And after surgery, it's important to try and keep their backs level, and each dog is different depending on their body shape. So I would set him on this gray mat. It's just a cheap exercise mat we got off of Amazon. This was really great because it gave him good traction and it gave him a safe place to be while I changed the bedding in the crate. When I would take him out, I would always offer him water. I didn't use a conventional bowl. I used just a yogurt container because it was easy to move around. So that was a good trick for us. In his crate, I would use a 3-component system. So I always on top had a towel. Then I had a potty pad. You're a good boy. And when the potty pads are soiled, I would just kind of fold them in and roll them up. Unlike I've seen my friends do with the diaper. Set that there so it doesn't get your floor dirty. And a blanket. So in the very beginning, Watson was pooping and peeing in his crate, and then mostly just peeing in his crate. And I found this system worked really well to protect him and also the crate. So ideally, this blanket does not get peed on. And then what you do is you put your fresh potty pad down. I found that Watson did not like to lay on the potty pad. And also, to prevent urine scald, I would set the, you're okay, buddy. Hey, Corgi. You wait. So I would set this towel on top of the potty pad to prevent urine scald and to just make it a little more snuggly for him. I would typically change the bedding first so that when I was done with him, I would have a clean, dry place for him to go back to. I set up a bin on our deck for putting the pee towels. Dog pee is very smelly and you'll go through a lot of towels. We went to Value Village and bought 5 or 6 used towels, and we'd stockpile them on the deck, and then when we had a load of laundry, we would just do a load of dog pee towels. We found that washing on extra hot with double soap got rid of the pee smell. when you go to take your dog outside, Watson at least was, he was fully releasing his bladder in the crate, but he didn't have total control. So I found it was good to have a designated jacket that could get peed on. So when I prepared to take him outside, I would first make the crate clean and dry, and then I would get on my clothes. So I put on the pee sweatshirt. I would unlock the front door, and I would set my clogs near the front door and turn on the yard light if it's nighttime. I would also put on a headlamp. That was really useful. With the belly belt, even though Watson couldn't move his back end, he was in the hospital for 6 days, and it wasn't until day 9 that I saw any movement in his body, which is perfectly normal. Some dogs start moving right after surgery. Some dogs can take up to 3 to 4 weeks. Sorry, Corgi. So when I was putting the belly belt on him, hi, I know, bud. I found it was helpful to tell him to wait, and then I would use one hand to pass it underneath him, get it set up, hold it with both hands, and then I would kind of pick up his back end for him. Corgi's not cooperating. There we go. Oh, and he's going back in his crate. But you can see how I used my hand to get him started with the belly belt. Then I would let him walk around the yard. Typically he would go poop on his own. After some amount of walking, I found that I learned kind of his pattern, and if he didn't poop, I would pick him up, carry him to the far side of the yard, and let him walk back with the aid of the belly belt, and typically he would poop then. Hi, bud. I know. You're doing a good job. The first thing that I noticed for Watson walking was just very slight movement of his feet, just back and forth, and then it grew from there. Will you hit pause?